My name is Ruth Anderson. I've been a nurse for 20 years. I work at St. Vincent Healthcare in the neonatal ICU, and I'm a member of the NICU Health Flight Team.
My name's Carmen Cox. I've been a nurse for 10 years. I work at St. John's United as a health director.
My name is Raylyn Harris. I've been a nurse for 12 years. I currently work at the Springs at Grand Park, and I am the Director of Healthcare.
Melissa Donahue, RN, Clinical Supervisor at St. Vincent Healthcare.
I'm Crystal Holycross. I've been a nurse for 6.5 years. I work at St. Vincent's Healthcare on the oncology department.
My name is Sarah Grace Martin. I've worked in the emergency department for 2.5 years as an RN.
My name is Amy Coleman. I've been a nurse for 1.5 years. I work in the ER at Billings Clinic.
My name is Amy Walton. I've been a nurse for 24 years, and I'm currently a nurse at Billings Clinic Inpatient Cancer Care.
My name is Nathan Moyer, and I've been a registered nurse for 16 years. And currently, I am the incident commander for the COVID response at the Lame Deer Clinic in Lame Deer, Montana.
My name is Esther Wynn. I've been a nurse for 40 years. I am a public health nurse, and I work at Bighorn County Public Health Department.
My grandfather inspired me to become a nurse. He had a few health issues when I was young, and I got to help him through a major surgery and take care of him for a summer, and I just remember how much he appreciated me and told me every day how much he loved me, and I knew I wanted to be able to help other people like that.
I became a nurse because when I was a child, my mother was a nurse, and every time someone mentioned my mother's name, they said she was an amazing person, an amazing nurse, and what girl doesn't want to be like their mother?
I had a handful of female friends that ski patrolled and also were nurses, and they really encouraged me to look into that, and that was something that I found a passion in.
The first time that I thought about being a nurse was probably when I had my first child. I really wanted to be an L&D nurse.
When I worked as a CNA, I realized that that was my passion, to work with seniors.
My grandmother was a nurse. She trained in the 1920s, and I grew up hearing her tell me stories about that, and I always looked up to her.
I knew I wanted to fulfill an obligation to the military, and I became a combat medic first.
It started when I was a volunteer at a local children's hospital in Fort Worth, Texas, called Parents' Night Out, and I would sit with the patients while their parents got a much-needed break and got to interact with the patients and the nurses that were taking care of them, and they were just so inspiring to me that I knew that's what I wanted to do.
I was still a nursing student, and I got called to help with a horrific car accident with lots of burn victims. And there was one particular patient who was badly burned. We worked as a team, we got him stabilized, and then I was able actually to see him walk out of the hospital some months later before I graduated from nursing school. And so that experience really solidified for me what I really wanted to be doing with my career.
One of my first memorable nursing experiences was receiving a patient at the Montana Women's Prison. I was a little nervous at first to go in, but they made me very comfortable, and it was a wonderful experience.
I remember in my early days of nursing a patient that I'll never forget. She was an older lady that had lung cancer, and I really felt like I had a bond with her, just taking care of her, and she's somebody that I just won't forget.
We had a resident who was actually passing away, and their family was basically living in our facility, and the daughters decided to make carrot cake and meatloaf, which was their mother's favorite recipe for their dad and their family and the rest of the residents.
I was a nursing student in college and had an observation day in the NICU and followed a nurse around for a shift, and just amazed at how tiny but yet how incredibly strong these little people are.
So my first nursing experience was when I was 16. I had the opportunity to go to Ecuador to assist the government with a measles outbreak, and we were vaccinating door to door. And that was a marvelous experience, and it was the first time anyone called me enfermera, which means nurse.
I had a patient with significant burns, and obviously that was very difficult to see when someone with burns is obviously very unrecognizable to what their normal figure and what their face would look like. but I spent a significant amount of time in that room because I felt as though that person shouldn't have to be alone as they were passing away.
My first experience in the ICU, I had just taken my nursing test to be an RN, and that day we admitted my dad into the ICU. And one of our more experienced nurses took him, and from that point on, it just solidified the fact that I was where I was supposed to be. I think the biggest skill is flexibility. No matter what job you have, it may be the same job every single day, but things change day to day. Just look at COVID. We weren't expecting something like that, and we all had to make major changes in our jobs to adapt to something so big.
I think it takes a lot of kindness and compassion to be a nurse. That may sound like a silly skill, but I think it's some of the most important ones.
Honor and respect for humans.
You have to be very organized, and you have to be able to notice every tiny little detail since the patients can't express to you what's wrong with them.
I think you need to have patience. You need to be able to critically think, and you need to be able to do that fast.
Conquer fear, that's why we're here.
If you have made at least one person breathe easier, then you have succeeded.
If it wasn't charted, it wasn't done.
If you give respect, you'll get respect in return.
It takes a village. None of us are here by ourselves. None of us are going to get through this alone.
One of my favorites is, you smell what I'm stepping in, which basically means, do you know what I mean?
Well, especially after COVID, it was pretty stressful, so we would all say to each other, we can do anything for 12 hours, right?
I would say being part of the help flight team over the last 16 years.
You get the blood drawn the first try for the patient whose veins always run away. Or you get to calm down a teenager who came in for vaccinations who was mortified and ready to run out of the door. Or you are able to talk to a woman and connect her with resources when you find out that she is suffering from domestic abuse. Those are the days, and they happen every day, that make me want to come back.
My greatest accomplishment is my children, and next would be my nursing career, as I started my nursing school when I was 40.
I think about a child abuse case that I had that was a part of years ago, early in my ER career, and a lot of the details from that still kind of haunt me today sometimes, but I was also glad that I was able to be there, to be a part of helping out in the best way that I could.
I think my greatest accomplishment is just every day that somebody gets to walk out of the ER and go home knowing that they don't have something life-threatening going on.
I was sent to a new patient's home. I went inside the apartment, I took her vitals, I did my assessment, and then realized that I was in the wrong apartment.
I had a patient who would always ask for his medication, and what he meant by his medication were mini Hershey's bars that he believed improved his eyesight.
I had a new grad that I was orienting, and she was trying to release the air from a flush in a syringe, and when she did, the solution sprayed across the room and got me.
I used to teach childbirth classes, and there was a couple. The husband was a cowboy, and he didn't think that there was a reason to be coming to childbirth classes because cows know how to do it. But then they had their baby, and he came back for the last class and told everybody, no, 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 no. It's a whole big deal, and you need to listen to the nurse.
I had worked a night shift, I went home, I slept hard. When I woke up, the sun was setting kind of low through the windows, and I started to panic. I looked at my clock, and it said 9 o'clock, and I was supposed to be at work at 7. And so I got up, I called the charge nurse at work, and I said, listen, you know, I am so sorry. I don't know how I slept through an entire day like this. I will be there in 30 minutes. And the charge nurse kind of sounded awkward on the phone, and he said, Nate, it's 9. I said, yeah, I know, I was supposed to be there at 7. He says, no, it's 9 in the morning. Go back to bed.
One funny moment I recall just recently was a patient. We did bedside report and we said, "Hi, Gene." And he said, "Welcome to the sanitation party." We looked at him in awe and said, "What?" And he said, "Hi, Gene."
One night, the RT and I had flown in the helicopter, and it was wintertime and very icy in the parking lot where we landed. And we were pushing the transport isolette across the parking lot, and the wheel got stuck in a little hole, and I went to push it and totally biffed it and landed square on my butt while still hanging onto the transport isolette. And he turned around and looked at me and said, "Are you okay?" And I said, "Yeah, I'm all right," still hanging on, and he just like practically died laughing right there in the parking lot.
I was kind of running kind of quickly because someone wasn't feeling good. I was trying to grab some meds out of the med machine. I ran toward it and I kind of rolled my ankle and did a header into the machine. I kind of saw stars for a while, and my patient that I was trying to help laughed at me.
And the last 2 months in particular, I've been covered in every body fluid, and just recently I spent 2 hours at work with my shoes squishing before I could get a new pair of shoes.
The best advice that I could give would be to be flexible and be willing to pivot.
Always question things, whether it be what you know, what you've learned, what someone has said to you, and continue to learn from that.
Some of the greatest advice I've gotten from my patients is to live your life to the fullest.
The best advice I've been given is to stay true to myself, be who I am.
You need to critically think, but you need to take your time. You need to think things through, try not to let your excitement dictate what you do.
Take care of the patients the way you would take care of your own child.
As a nurse, you are the patient's best advocate, and you have to always advocate for them.
To always be honest, and when you leave work, to try to leave it at work and not take it home.
"69 people died in my county, and I think I know probably 54 of them.
Last year in Lame Deer there was a large surge of COVID-19 cases, and I believe we lost over 40 people in a real short period of time. That was really hard to fathom because of just how connected those people are. It felt apocalyptic.
Our seniors were very isolated throughout COVID. They weren't able to eat in the dining room, families weren't able to visit, and it was just really tough on them.
After caring for residents for over a year, they become your family and you get very attached to them. And being able to be by their side during their last moments is very comforting.
Hearing my patients be told that they were having to go home to die and not having family there with them, and being the one person that could still give them that caring touch, hold their hand and dry their tears, that was really tough.
There was a gentleman that had COVID that was very elderly and in isolation, and we put him on hospice care, and I had to call his son and talk to him about choices we needed to make and what we needed to do. And the hardest part was that night before I left my shift, holding the iPad in the room with his father, unresponsive, and trying to explain to him and let him have his last words with his dad.
It's forced a lot of us, myself included, to work with fewer resources or get creative in our own nursing.
I took care of a woman who was admitted for COVID, and she could barely move without desatting, and she needed intubated. And we knew that she was going to be intubated and then probably would never come off the vent. And she kept asking for her husband to talk with him about her last wishes. I discovered that he had already been intubated for COVID as well, and neither one of them got to talk to the other before they both passed away.
To be a nurse in the ER, I think it takes a lot of grit and patience. You're generally running from start to finish.
I think you have to be a strong individual.
It takes dedication, a good sense of humor, and having wonderful coworkers.
This past year's been really difficult, and I think it just takes extra kindness and patience and resilience to get through.
Being positive. Even when you're at your darkest moments, the patients see that, and we have to stay positive to keep them going forward as well.
You need to take care of yourself. And part of that means accepting help from other people.
When I have a difficult patient, I always like to take a moment and I actually imagine them as a little kid, themselves, who they were and who they are, and try to not let the situation at hand cloud my judgment in caring for them.
I think the biggest thing to be compassionate is human touch, whether it's holding their hand, drying their tears, or giving them a big hug or a celebratory high five when they finish their treatment. It's personal touch for sure.
I think trying to empathize with them is the most important thing.
Sometimes it might seem like there is no hope left, but a nurse's job is to nurture hope. One can hope for a peaceful passing, or hope to be surrounded by loved ones in your final hours, or make plans to reconcile with a family member.
They may not remember your name, but they will remember how you made them feel.
I feel like our job is stressful enough that I really do need to be positive for everybody.
I hope that I inspire others by wanting to give dignified care and compassionate care and just take really good care of the people that we serve.
I just encourage people to do the best they can every day and live their lives.
Lead by example, whether it be being the person that's always going to choose to wear my mask or choose to try to make the right ethical decisions.
I like to lead from behind, and I find that if you help someone find their voice, that there's a leader in all of us.
I try to lead from the front. So if there's something that people are unsure about how to do or a little bit afraid to try, I'll be the first one to do it so that they know that I won't ask them to do something I'm not willing to do myself.
I really try to be a good teacher and help the nurses that are brand new and up and coming, and be there for support, but kind of stand back and let them dive in and get some experience.
It's never too late to start a nursing career.
I do think the pandemic has really made me and my coworkers better nurses. We have been stretched to the limit and pushed to the limit, and we did not ever realize we could do the things that we have done.
This has been a calling for me, and I wouldn't change anything.
It really is the little things that matter the most.
This past year has reinforced to me that the human spirit is really powerful.
Working through this last year, I've really learned how important it is to have grace for my coworkers, myself, and for all of the families that we're caring for.
There's no better way to find meaning in your own life than to be a nurse.